Thank you. Welcome to the Southbridge Town Council Special Town Council meeting, Friday, March 20th, 2020 at 5 p.m. Call this meeting to order. Please rise for the Pledge of Allegiance. Pledge allegiance to the flag of the United States, one nation, under God, indivisible, with liberty and justice for all. Okay, so roll call. Our secretary is working remotely. We'll be taking minutes of the meeting. So I will, Councilor Daniel will call the roll, and she's taking all the recording at home, and we'll be transcribing the minutes for this meeting. Councilor Daniel, roll call.
Councilor Adams.
Present.
Councilor Catrona.
Present.
Councilor Daniel, present. Councilor Jovan.
Present.
Councilor Lazo.
He's excused.
Councilor Manna.
Present.
Councilor Marchetti.
Councilor Marchetti and Councilor Nash are participating via remote participation.
Councilor Steves.
Present.
Okay. Just an announcement. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, Mass General Law, Chapter 38, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Southbridge Town Council is being conducted via in-person and remote participation. There is no in-person attendance of members of the public that is permitted. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. For the record, I'd like to thank Southbridge Cable Access for being here this evening to allow us to do this as a live meeting. And I appreciate the fact that councilors have come in person for this important meeting of the council as we try to move forward in the pandemic and coronavirus COVID-19 emergency in the nation, in our state, as well as our community. Every effort is being made to make sure that we have as much transparent government as possible. That is why we did this as an important meeting for this particular session. Going forward, it's going to be a challenge for our community to have regular meetings like this, and a lot of work will be done via remote participation. I'll have furthermore on that when we get to an agenda item. As far as the chairman's announcements, again, just want to reiterate that we are in a time in our nation, in our community, that we have never witnessed before. A pandemic emergency which threatens the lives of many people. However, we as a town are working very diligently to ensure the safety of all our residents and our employees. As such, that's why I call this special meeting. I just want to inform the public that in the audience we have our fire chief, police chief, public health officials, the Board of Health, and I appreciate the fact that you have come to this meeting. As the President of the United States has stated so many times, and it's been reiterated not only by the President and his public health officials, but those in the state government, Governor Baker, and everyone else, to practice social distancing. And as you can see on this podium tonight, we have practiced that to the best of our ability. And that really is a key as we move forward to make sure that we do everything in our power to take this pandemic seriously in our community and make sure that we practice hand washing, social distancing, so that we can keep this at a bare minimum. We know people are going to be sick, and as we're going to hear later on tonight, that we do have members in our community already that have this virus. So it is very important that we all practice and do the best we can to make sure that we're all safe going forward. I'd like to thank the town manager over the last 2 weeks, bringing together a group of individuals throughout the community, and he'll touch on that, members of the President and CEO of Harrington Memorial Hospital, our police and fire chiefs, our public health officials, the school department, to all come together and as a team approach to make sure that we're preparing ourselves as a community to be able to continue operations. This is an ever-changing, by minute, and it literally is minute by minute, disease or virus. I just want to ensure all the residents of the town of Southbridge that together, the council, the Board of Health, our public safety officials, and everyone in town government has been working very hard to make sure that we have continuity of government and that the town of Southbridge continues to operate and provide services the best that we can as we struggle through the ever-changing challenges that we have, where we're closing town halls, closing businesses, and trying to deliver all the services that we have to in a safe and efficient manner. I've had the opportunity to attend those meetings on behalf of the council as the chairman of the council during this declaration of the state and national emergency. Later tonight, we'll be discussing the declaration of a local emergency. That is to ensure that whatever we need to do as a community to ensure funding and the ability to act in swift and meaningful ways we'll be able to do. Early today, as chairman of the town council, I attended the department head meeting of the town officials. We had conversations regarding what the next steps that the town of Southbridge will take in battling this challenge that we have. To that end, later on tonight, we'll have the police chief and the fire chief and the public health talk to us a little bit about where they're at right now and plans moving forward. As of today, at 3 o'clock, the town of Southbridge has partially opened an emergency operations center. We are operating under a unified command under the incident command system to make sure that all services that we need to deliver to the residents of the town of Southbridge are delivered in the proper way that provides health and services to you, our citizens, as well as the safety of our employees. Chief Woodson and Chief Normanton, police and fire chiefs, will be the incident commanders for this pandemic event. It is a challenge for the town of Southbridge because not only are we working daily now going forward and making sure that we have a structure in place that we're able to respond to the challenges that we have as a community, but we as leaders of the town also have to make sure that we provide the day-to-day services and provide the governance to you, the residents of Southbridge. It will be a challenge because we are operating in a society right now where we're not going to have face-to-face meetings. A lot of our work will have to be done remotely, and we're doing the best to make sure that we're putting systems in place for all our boards and commissions, the town council, and the Board of Health to work remotely, but also provide the transparency to the local residents that is required by the open meeting law and that you deserve. So it will be a challenge over the next week or so as we put systems in place, and we will get that information out. Under the incident command structure, we will have one voice that will communicate where we are as a community. All information will be going through the emergency operations system, and the team in place will consist of myself as the municipal official under the charter, which states that in a time of emergency, that the governor recognizes the town council chairman as the head of government, which is required under our charter. To that end, we will work as a team along with the town manager, the chiefs, and our public health officials to make sure that everything possible that we can do for the safety of you, the residents, and the governance of our town will continue on a day-to-day manner. Again, this is an ever-changing event. It is a challenge, one that I've never seen as a municipal official, either in my law enforcement, fire, and EMS career, or in town government. I appreciate and thank the chiefs, the deputy chiefs, and everyone involved to this date who have come to the table. And I also would be neglect to not thank the school system. Dr. Jeffrey Villar has put systems in place and has been readily available in providing us support as we move forward. And the school system is an integral part of our emergency operations team, and I thank everyone involved. Together, as a community, if we practice the standards that the President keeps saying every day, that Governor Baker states every day, that social distancing and hand washing and sanitizing will help curb the rise in the virus. We have to take that seriously because our systems will become overwhelmed. We have the challenge of a local hospital in town. Many of our family members work in the medical field, and we pray for them every day. However, we are here together as a community, as a council, that as long as we work together and continue with the mission that we set forth, tomorrow we'll be here, we'll be safe, and hopefully within a few weeks we'll be looking back at this and laughing and saying, can we believe that we made it through? But together, we will make it through. This community is prepared, our officials are prepared, and we will move forward. With that, the town manager will outline some of the events that have occurred within the last 2 weeks throughout the community with groups that he has led, and I'll turn it over to the town manager. Mr. Town Manager.
Thank you, Mr. Chairman. I want to start off by thanking you for your leadership, particularly today as we formed an EOC, Emergency Operations Center. Your experience as a police chief is very helpful. A lot of the concern have been from people I talked to of what the town is actually doing. And I want to first thank all of the town employees that have been working diligently to make sure that we provide services to the people of Southbridge. So all employees are still working while the buildings are closed to the public. Employees are doing everything in their power to provide quality services to the town. Particularly our police, fire, and DPW that are out in the streets. We appreciate all the efforts of all of our employees. I did have the opportunity to meet with all of the employees. I went department to department to answer concerns and questions and tell them where we are as a town and the things that are taking place in our coordination of efforts. To that end, the chairman talked about a group of people I put together, and I want to let you know about that group and who they are because I really think it's important that you understand the dynamics of what's going on, and in fact, people are all working together to deal with this complicated issue. The team, and this is really a coordination team, is made up of Andy Pelletier, the health agent, Elizabeth Stevens, the chairperson of the Board of Health, Roland LaRochelle, the vice chairman of the Board of Health, Edward Moore, chief executive officer and president of Harrington Hospital, Jeffrey Villar, our school receiver, Jack Jovan, our town council chairman, Paul Normanin, our emergency management director and fire chief, Pat Haddock, our director of counseling on aging and community services, Karen Harnois, our finance director, Augustine Agustile, he's the administrator of Southbridge Rehabilitation Center, myself, Cheryl Owinski, who's our public health nurse, Shane Woodson, our police chief, Heather Blakely will be added to that team. It's a team of people that are coordinating and doing everything they can to share information about what is happening in their organization, and they're all agreeing to work together to protect the people of Southbridge. Some of the things that have happened, some of the clear tasks that have been completed, as everyone knows, all schools are currently closed, public and private, K through 12. All town buildings have been closed to the public. We've tried to keep citizens informed through Facebook, Reverse 911, town websites, press releases, public access television, and other media sources. We encourage everyone who can to sign up for our Reverse 911, which is on our homepage of our website, so we can get information out to you as quickly as possible. As the chairman said, we have this, as of 3 o'clock today, set up the EOC, and he talked about what that is. The Southbridge IT director is establishing the ability to have remote meetings and testing those systems so that we can all communicate. Harrington Hospital and the fire department are working together to outfit the police department with personal protection equipment. The sewer and water operators are developing plans to be prepared for any emergency. So they're making sure they have the appropriate chemicals and that those two facilities can continue to run efficiently through this process. As you know, the town, the state, and the federal government has recommended that all gatherings of over 25 people be canceled or postponed. I think the president is actually recommending groups of 10 or more should not occur. I've met, as I said, with all departments to inform them of various issues. The IT director is currently working to allow town computer access from home employees. If our employees are required to work from home, they would be able to tie into their current desktops at work that allows them to keep working through this difficult time. The DPW director is also developing a plan for split shifts to protect workers if an employee gets the virus. As of right now, Meals on Wheels is still operating at the community center to ensure that we get meals out to the seniors who so desperately need it. We've also given permission for all essential employees to be able to travel through towns. If, God forbid, the state or federal government closes the state, certain essential employees of town government need to have the ability to be able to use our transportation to get to work. Also, I think I announced it, and the chairman clearly announced this, that the school department has been working to get breakfast and lunch to all students who need it, and we're going to continue to do everything in our power to reach out to those students. I want to encourage the children in Southbridge. We have closed all town parks, and I know that kids want to go during this time when they're off from school to go play basketball, go out to the parks. We encourage you not to do so. We can't have those kind of gatherings. We surely don't want a bunch of kids working up a sweat and being that close in a basketball court. So while it's difficult, I would encourage parents to do everything you can to keep children from gathering and inform them of just how important this particular emergency is. With that, Mr. Chairman, I thank you, and we'll be discussing later the EOC.
Thank you. Agenda item 7. Vote to confirm the implementation of the governor's order suspending certain provisions of the open meeting law in order that all boards and commissions follow the procedures as outlined in the guidelines to be developed by the town clerk and town manager's office. Is there a motion?
Second.
Discussion. So in your packet tonight is, I have already implemented this, and it is on the town website because some kind of action needed to be taken so that we could operate government. So this is simply to confirm the implementation. This language was taken off of guidance that was provided to me by town clerk Maddie Bonadies, who had received alerts from the law office of Kopelman and Page. So it's simply an order about how we will do virtually. Going forward, we are working, I know there was a board last night that because it was a public hearing that needed to have participation, they did do that meeting publicly as best they could. There's one more meeting next week as well with a board that's time sensitive. We have asked all boards to suspend any hearings or meetings that they do not necessarily need, to suspend those meetings for at least the next 2 weeks so that we can limit the number of meetings that have to be held and the challenges that we have with technology. To that end, I had 2 subcommittee meetings this week that we canceled, and we will evaluate as a council how we go forward remotely, and I would indulge the council not to have any subcommittee meetings for at least the next 2 weeks until we know where we're at, and that we will have I did also move our regularly scheduled council meeting from next Monday, the 23rd, to the 30th to, one, allow this virus to see where we're at, and also to make sure that we have whatever technology in place. So I would just ask you to support this implementation as written. We do have it on the website, and it just gives some guidance as to how we will proceed. We are going to do every effort we can at some point to allow for the public to be able to interact with council during the council meeting, as long as we can get the technology available. The challenge would be on phone calls to know who's out there and be able to recognize them to speak. At this point, the biggest concern and that we need to do is to act as a council so that we can provide whatever governance as a council that we need to do, and the Board of Health as well. So while the charter may say that people have the right to be heard, at this point, it's suspended because they cannot attend meetings. Let's do everything we can to try to get something in place. So within the open meeting law. Councilor Manna?
Thank you, Mr. Chair, through you. So with the suspended rules of the open meeting laws and the necessity to do the social distancing and whatnot, I know our charter dictates that we have 2 meetings per month. However, maybe the further we go down the road, we should look at this and say, do we really need those 2 meetings a month right now during this emergency? And maybe combine everything into one? Should it not be like necessary?
Nope.
You know what I mean?
No, I do. Thank you, Council, for that, because at this time, again, it's unprecedented. So we are in an area that we need to be able, honestly, I do believe that as a council, we may have more conference calls as a council to make sure that we can have dialogue on where we're at as a council, and we can set those up as an open meeting law, and have however we want to do it. So we will work on that for regular updates as a posted meeting. But as far as the regular business, we do know that the charter requires that the budget be presented to us by the end of the month. Yeah. We have more important things than to hold the town manager to make sure that budget actually drops on the desk on March 31st. I mean, they need to get it out to us, how that's delivered, how we debate that budget. I'm not worried about next year's budget right now. I'm worried about getting through the next 2, 4, 8 weeks. The budget will take care of itself. I mean, there's not like we have a ton of money out there that we're going to be adding all kinds of positions as long as we can get to July 1. Even if the governor may say, listen, we're postponing those dates certain, we're going to have a lot of challenges because there's going to be expenditures within the state and local governments that we're going to have a lot of challenges. So thank you for that. We will evaluate it. My goal will be that council's fully informed on daily briefs as we talk about through the EOC conversation later on. But I don't think there's anything so personal with any other board or commission that can't wait right now. We'll just get the major portions. The 2 main agencies that I see right now, or boards, is Board of Health and Town Council, to make sure that we manage the town to get through this crisis. So thank you for that, and I appreciate it. Thank you. Any further discussion on this? All those in favor? Opposed? Oh, I'm sorry, did you have any conversations? I'll hold off on the vote. Councilors that are out there, did you have any conversation on that? Or do you support it?
No, sir. Yes, I voted affirmative.
Affirmative? Okay. So I'll ask. Councilor Marquetti? Well, I'll go through roll call because we are remote participation. I will do a roll call. So Councilor Daniel, call the roll.
Councilor Catrona?
Yes.
Councilor Daniel, yes. Councilor Jovan?
Yes.
Councilor Manna?
Yes.
Councilor Marquetti?
Councilor Marquetti? Yes.
Councilor Nash?
Councilor Nash?
Yes.
Yes.
Councilor Steves?
Yes.
Councilor Adams?
Yes.
Thank you, councilors. Thank you. Thank you, councilors out there. I'll try not to forget about you. Are you hearing everything okay?
Yes, sir.
Okay.
Yes, sir.
Thank you. All right. Well, at least we know that. So thank you, Will, for putting this together. We got something going good here. All right. Next, we will have the Board of Health, Director of Inspections, or designee. I know the Director of Inspections here, as well as the Vice Chairman, right, of the Board of Health. And I appreciate you for being here, Roland Larishow. Update to the Town Council and to the public from Department of Public Health, Center for Disease Control, or other sources relative to this COVID-19 state of emergency. Andrew?
Good evening. Thank you for inviting me to this. I'm going to be all over the place because every time I wrote what I have to do,
Make sure you speak into this.
every time I wrote down what I have to speak on, I write a bunch of words and say, I got to speak on this, this, and this. And this thing is so dramatically changing that the list is in a mess. So a couple of points that Chairman Jovan brought up. The Board of Health today discussed possibly not having as many meetings, and because there is a law out there that says that I can act for the Board of Health, but they have to be informed of it in a reasonable time, we actually ended up coming to the consensus that we will probably try to schedule one meeting a week, and just to make sure that as a decision is made, it's verified by the board or altered by the board. I do have the authority to make the decision, but the board has to ultimately have the ultimate say on it. So the Board of Health is actually planning on more meetings because of the fluidness of the situation. As far as the response system, I believe that the system we are moving to, the incident command system that Mr. Jovan just referred to, I believe it's a better system than we had in place previously. We participated in the previous one as partner. We are fully intending to participate in this one, and if a better system comes forward, we will continue to participate until this problem, this concern is gone. Aside from the emergency response meetings, we are meeting with multiple partners out there. We are sitting on the town manager's response team. Some of our partners in that include the schools, Harrington Hospital, the rehab center, senior center. We are just, everybody that we think is going to be vastly affected by this, we are involved in the meetings and the discussions and the decisions on those. Additional to that, I have created a group of abutting boards of health that I am in constant contact with, obnoxiously so. So we know what is going on in the bordering towns, understand that anything happens in our town, somebody goes and visits another town, and all of a sudden 2 towns are involved in this thing. This is a I'll use the word runaway condition, but only because the people travel. I want to stress that the situation out here is handleable as long as people act intelligently on this thing and continue to practice the proper prevention. We currently have Massachusetts currently has, as of 8 o'clock this morning, 328 cases. Southbridge, 328 confirmed cases as of 8 o'clock this morning. I don't know what's changed through the day. This is moving fast. Southbridge currently has 3 confirmed cases and 2 suspect cases. I want to also reiterate, or at least put forth...
Can you speak up? Because...
I want to put forth that we have 0 deaths in this town, and it is our goal to maintain that number as solidly as we can. The Board of Health gets reports of all of the cases, and we follow up on them. The follow-up includes contact with the case, wherever possible. I know we have 1 case in the hospital, so we can't contact them yet. But the follow-up consists of contact with the case, finding out who their contacts were during the possible shedding time, and then following up with that. A lot of times these contacts are in neighboring towns, so that's where the cooperation with neighboring towns is coming in. We might have somebody who lives in Southbridge but works in Charlton. We need to contact Charlton and work with them on that one. We are on top of every case that has come in so far proven positive. The cases that are suspect, and the cases that are positive, we ensure that they adhere to isolation and quarantine requirements. If we feel they aren't, we have authority to enforce that they do. Luckily, the cases we have so far, we don't feel that has to be. We don't have to use enforcement. The people understand the situation here, and they seem to say, you know, something in the best interest of the neighborhoods of the town, we're going to stay quarantined. So our biggest tool here is self-quarantine and other means of prevention. On October 10th, Charlie Baker put forth an edict, an order regarding this thing. It's been 10 days since then. Charlie Baker has put forth 20 orders in that time, every one of which the Board of Health has to review, compare with the laws, interpret, and put into place. Aside from that, we get constant guidance from Mass Department of Public Health, probably 3 times as much guidance as we get from the Baker administration as far as orders. So we are extremely busy. I've got 2 people in my office dedicated to this right now, except for periodic. Miss Alicia is in my office, and she is pretty much on this with me, except when we get a case of a residential complaint or something that we have to visit. We still have to keep the office operating. So she is my primary on housing inspections, and she is my backup on coronavirus. More important than the orders that we're getting And the guidance that we're getting is the lack of guidance that we're getting. We put forth a lot of policy. The board puts forth policy based on the guidance, and sometimes based on lack of guidance, and then something comes up that changes our minds. We have instituted several policies that we have had to have emergency meetings and turn backwards because of new information we got. The latest of that was today. We did have an emergency meeting of the Board of Health. Every order that comes in, we ensure enforcement adherence to those orders. I have a food inspector who goes out at least weekly, visits the operations to make sure that nobody is having in-house service, and also to make sure that there is a food code law out there that requires any food handler who is showing any signs of sickness or certain signs of sickness be excluded. So she is going into these establishments and talking to the managers, making sure they're aware of that exclusion rule, and observing the workers that are on site. Unfortunately, many workers have been laid off due to the non-eating in the building. But she is in these, making sure that to adherence to that law. I think exposure through our food is probably one of the most scary possibilities, so we're going to control that until regulation comes down to otherwise control that. The Board of Health has, for a long time, spoke of an emergency dispensing site. We are ramped that up, the design of that, and the discussion on that to ensure that if vaccine does become available, the Board of Health is ready to respond to this thing. We spoke today about the possibility of having to pass out anything else that might be related to this incident, and determine that the EDS drive-through site might be a perfect thing for that. So it's a multi-use site, and I think it's going to be significantly beneficial to the response to this thing as we go further. Today, the Board of Health declared a public health emergency. We did that for purposes of allowing access to maximum resources. It may be redundant to the state's declaration of an emergency, but we wanted to make sure that any opportunity does not fall through the net, so we're just drawing a bigger net and declaring the public health emergency. We also, in the back of our mind, realized that the action tonight could result in a town emergency by the council, and we wanted to show support of that. Our goal in this thing is to spread this disease out. We do not want to overwhelm the medical system. There is two responses to medical going on here. We have the medical system, which is your hospitals, your EMS, and they are responsible for when you get sick. They treat you, they do the best they can to get you better. The other side of this is environmental health. That's where public health comes in. We try to control the environment to minimize the impact on the medical end. To that end, we continue to encourage prevention, which consists of social distancing, coughing into your inner elbow rather than into your hands, washing hands properly and frequently, and staying home with any illness. I just want to put forth that this is not the end of the world. We will get through this, and I'll close up with that unless there's any questions.
Okay. I'll go town manager, then I'll start with council.
Sure,
Town manager.
and thank you, Mr. Chairman, I appreciate it. I want to take this opportunity to thank the health agent and the Board of Health. Over the last couple of weeks as this issue has developed, I've had to lean on the health agent numerous times, and we've made a lot of decisions without, frankly, in a lot of occasions, without any federal or state guidance. And I want to thank him because in many cases, as I dealt with the health agent, it was always making decisions in the best interest of protecting people. So sometimes some people might think we were overly cautious or overly protective, but frankly, at this point, when you have no guidance from the State Department of Health or any other official, I'd rather side on caution than moving forward. I'm very pleased with and the chair talked about the Emergency Operations Center, that it's going to allow more authority for the chairman and for the emergency management director and the police chief to take some of those responsibilities that I and the health agent have had over the last couple of weeks, and allow us to focus back on general government and him to really focus on the health agent. But Andy, I just want you to know, personally, I appreciate the difficult decisions you've had to make, and he's right, we've changed those decisions where we made a decision, the next day we were changing that decision because of new information came in. It's been difficult in coming to conclusions. I have never seen this in, the chairman talked about his years, I've never seen this in the 25 years I've been involved in government, so everything seems to be new and ever-changing, and we're making the best decisions we can at a spur of the moment, and evolving and learning from every decision we make. So thank you, Andy, and thank the Board of Health.
Councilor Steves?
Thank you, Mr. Chairman. A couple of questions through you to Andy. First off, you're probably aware. I just want to get an update on what's going on with the high-rise.
There is, I don't know how much I can say in public venue. You know that the HIPAA laws are still in place with
I know individuals
with
can't be
minimal relief.
spoken about. I understand that. Sure.
We've got a report of a case at the high-rise. I think I can say that without going into any more detail. We contacted the high-rise promptly. Both Ron and I were in the room when this happened. We contacted the high-rise, and the director of the high-rise asked if she could put signs up. We basically said that that was her call at this time. I went back and did a lot of research in a little bit of time. And about 10 or 15 minutes later, I called her up and said, I am not mandating you put signs up. If that happens, that's your choice. However, I am mandating that you do a thorough cleaning of all common areas of the place, paying particular attention to the route of egress from his apartment out the front door. In a very short time, I found out that this gentleman is a very mobile gentleman, but he doesn't spend a lot of time in the common areas. He's not a big socialite. So I feel the response is adequate. She called her directors and pretty much got backing from what I said. So we're confident with the response. I spoke to her this morning, suggesting that the signs might be more detrimental than beneficial at this point because she's had time to clean. So I believe, and don't quote me because I haven't been down there yet, but I believe the signs are coming down or are down.
Okay.
You all set?
That's good. I had a couple other questions too. Also, we got an email regarding Renaissance Medical holding public
missed it.
events.
Can you speak louder? I missed
I
that.
said I think all of us got this. We all got an email regarding Renaissance Medical holding public events.
I'm sorry, I can't
much
hear you.
larger than
Discussion
25
that
people.
we had at the EOC in regards to Renaissance and the
Yes.
adult day.
Okay.
What's going on with that?
We investigated that. I believe both Alicia and I 2 days ago went down there, spoke to the Renaissance group. We have and I responded to both Jack and Ron on this because that's where the email came down. But we did an investigation on this. Mass Health oversees adult daycares. They put forth a statement on the 17th, well after Charlie Baker's declaration of you have to be 25 or less. And their declaration is that they recognize that a lot of the seniors or a lot of the adults might be staying home in this, and they left it up to the adult daycares to close if they felt that their benefits were not being used. So interpreting that, and I cannot second guess Mass Health, they are direct to public to DPH. Interpreting that, at this point, I'm allowing that to continue because they have the interpretation that the benefit must outweigh the detriment, but they are indicating that it can happen. I do have a call into them, and I will enforce that call come Monday to see if they have any updated thoughts on that. But and that is one that we are watching carefully. I am kind of with you. The first thing in my mind is 35 to 40 seniors in a room together seems to be in violation of the 25 ban. But I have to defer to the public health overriding authority that on the 17th they said they said to leave it up to the daycare. I have that as a document, so it's recorded.
And also, I was curious about, have you seen concerns from some of the companies that are running group homes and related, those kinds of facilities? Have you been in touch with them?
Nothing has come into the office. Group homes are institutional. I'm putting on my building department hat now. Group homes are institutional use,
Right.
unless they are under a certain number, in which case they fall under single-family dwellings. So we have authority, we have wide public health authority. However, single-family homes are not on our target, so they are recognized as single-family homes if they're under, I believe it's under 7, but it might be 4.
Okay. But you haven't heard any issues
I
from
have not
that?
heard
That
anything come
population
back.
is also pretty vulnerable as far as viruses go, so.
Well, I just,
Nothing has come through my office.
on a personal experience, I have several that are on my street, one directly across from my house, and they are in the house, they're not going out, there's no transportation, Center of Hope is closed down.
Right.
Councilor Daniel used the drives for that, so pretty much they're self-sustained as if they were sheltered in place on their own.
Understand,
I
we're
had
not-
noticed that since I do Meals on Wheels, and the people who were doing one of the group home companies was doing volunteer route for one of our routes, and they're not doing it anymore either. So I was checking to see where things stood for the other companies, just to make sure that they were okay, because I know how vulnerable they can be, because I've worked in the companies too. So
Okay.
and the last question I had
Actually,
is,
can I understand
Okay.
that as of right now, we are under, no, and I don't know what's going to happen tomorrow, next week, or the week after, we are under no general quarantine. So as with any house,
Right.
they want to go for a walk, they want to go to the grocery store, they want to,
Right.
Cumberland Farms,
oh,
it's,
sure.
it's fine.
And the last question I had is, I don't know if the Board of Health has discussed this, or in your office you've discussed this. Do you have any recommendations for the citizens about reinforcing people's own immune systems via vitamins and food and things like that they can take care of on their own without having to go buy stuff and that kind of stuff? Has there been any discussion on that?
No, and
No, okay.
particularly because I am not going to encourage, even with over-the-counter type supplements, I am not going to encourage self-medication without knowing the physical condition, and this would be more of a medical end of public
That makes
health.
sense.
But I'm not going to encourage taking of any internal medicines, whether over-the-counter, not over-the-counter supplements, without knowing their physiology,
That makes sense.
if there is such a thing.
Okay, thank you.
Go ahead, Council. And I just want to ask the council, part of the guidance that will come out is, I'm going to ask all councilors, if you receive an email from any constituent of any concerns relative to COVID-19 only, so to coronavirus, this issue, if you receive an email such as Renaissance Medical Group or any other issue, to send those concerns directly to the two incident commanders. You can copy Andy so he's aware of it, but any response will come directly from the command center. Okay? Just, but again, and we had this discussion, only relative to COVID-19.
Right.
Any other issue that you get handled throughout normal course of business.
Right.
Okay? All right. Councilor Manna?
Thank you, Mr. Chair, through you. Just a couple things. So as of 4 o'clock today, there was 413 confirmed cases in Massachusetts. Worcester County sees 19. Out of Massachusetts, 195 of those cases were female, 218 were male, 97 connected to Biogen, 63 local transmission, 49 travel-related, and 204 are under investigation. 1 death attributed to COVID-19, 58 patients hospitalized, 199 not, and 156 under investigation. Just, that can be found on the mass.gov
Yeah.
website. Andy,
Please.
as with regard to local, some of our local businesses, tattoo parlors, hair salons, massage therapy parlors, tannin salons, nail salons, how are we handling those?
Again, no guidance has come down from the state on that, and the board is very aware of it. People are talking about it, but the board has not taken a stance on those yet.
Okay, I think there could be some state guidelines, but it's up to the towns to make those decisions. So I guess I'm just going to ask this question, and this will bring in the Renaissance question too. If we as a town declare a local emergency, a public health emergency, the Board of Health already has done, don't they have the authority to stop and decease? I don't even know, desist, or whatever it is.
I'm not going to answer that.
To stop this. I mean, because this is direct contact, and, you know, I mean, our own hospital is, or our own doctors are asking us not to to make unnecessary appointments, hold off on your annual physicals. Our own dentists are saying, we're closing down, we don't want to see you just for regular cleanings. If it's an emergency, give us a call, you know? So, I mean, if we have our medical facilities doing this, and they are, and I believe the state is giving us guidance, it's just, it may be vague and hard to interpret, but I believe that they are giving us guidance on this. So, that's my question.
Ed?
Public health has broad authority.
I can't hear you. Speaking.
Public health has broad authority even without a declaration of an emergency. So if we felt that there was a threat, and this hasn't been discussed with my board yet, if we felt that this represents a threat, even in the best of times, we can shut them down. Having brought that up, we will probably visit this. The concern with the disease is apparently, the virus is apparently passed through droplets, not necessarily through touching of the body. The medical field is doing it to protect the medical field. The dentist looking down the throat of somebody is probably the most susceptible person. So they're doing it to protect the medical field because the medical field has to stay intact through this thing. If it is the board's decision to visit this, I will definitely, like I said, we're going to meet every week. We will put it on a board meeting and at whatever time they tell me to put it on the agenda.
Okay, so I totally understand what you're saying with that. But here I am, okay, we got our senior centers or our nursing homes stopping all visits for our seniors because of the fear of them contracting this virus. So I guess I could be we're sitting 6 feet apart, right? Because you're right, it is droplets. But when I'm talking, something could come out and I could put my hand down, right? And the next thing you know, I'm like this, you know, so it's all over the place. So, I mean, and that's natural. It's not natural for people just to keep their hands by their sides all the time, constantly, right? And not touch anything. And, you know, I mean, I'll be honest with you, when I talk sometimes, spit comes out. I mean, it happens to everybody. So, I mean, this is something I believe that the Renaissance, what Gus brought up, I really think that should be looked at. And shame on the state if they really did say that. That's all for now. That's it.
You all
Thank
set?
Yeah, I'm done.
All right, before I
Sorry.
go to Councilor Adams, Councilor Marquetti, do you have any questions? Councilor Nash?
Yes, it's a line.
Which one is this one? Is this Councilor Marquetti?
I have a comment to make. I just would like,
Go ahead.
I would like the health director to keep the public informed of any coronavirus cases in Southbridge. I don't think we need to keep everything under wraps. I heard about this coronavirus at the high rise at about 4 o'clock, and by 5 o'clock it was on Facebook. So I think residents are going to find out about it anyway, no matter what we do. So it might be just a good idea. I would rather see the town inform the residents of what's going on and not Facebook.
Yeah.
I'm not criticizing you, Andy. I think you're doing a good job. I would just like to see the public just informed. Thank you.
Thank you, Councilor. And to that point, through the implementation of the command center and unified command, the town will be providing through the incident command daily briefings to the public. So we do have a plan in place, Councilor Marquetti, to make sure that information is gotten out to the public in a timely fashion. Okay? Councilor Adams?
Thank you, Mr. Chair, through you. Just three.
There's a delay,
Oh,
so.
yeah,
Yeah.
I'll wait 5 minutes. First question is that yesterday there was a conversation.
Can you
about-
do your mic down there? Yeah.
Yesterday there was conversation about employees within town that have traveled domestically, and they were required by the end of the day that they had to stay within the residence or self-quarantine for 5 days. You were addressing that this afternoon, I believe, at the emergency hearing or meeting of the Board of Health. Has that changed? Can you give me an update on that? I didn't get a chance to look at the YouTube video at all.
This is, as Mr. San Angelo expressed earlier, we are creating policy, we are changing policy, and when the policy changes, we are then editing the policy and redrafting the policy. This is how quick this thing moves. Today, the Board of Health took a vote in support of my original decision. Again, I can make a decision in absence of the board as long as I meet up with them and inform them what's going on and give them a chance to weigh in. So they voted in support of my action at the time. They then took a vote to amend my action based on the newest information we got, and they voted that anybody who has an exposure will suffer, or not suffer, will have to experience the exclusion for 5 days. However, and that any travel to the hotspots in the country, I can't think of the counties, but Washington, California, and New York are considered the 3 hotspots now. That could change, so I'll leave it at the hotspots. They would have to suffer, whether they drove there or flew there, they will have to experience the exclusion. However, air travel, domestic air travel in and of itself will not be considered an exposure. So therefore, as it stands right now, those employees can come back to work, and any employee who flies within the United States, but outside of those hot zones, can come back to work on day 1.
And that may change tomorrow.
There you go.
And I completely understand how fluid this situation is, so I just wanted to, the information we received yesterday, we have not received an update on the decision you guys decided to make today, so I just wanted to update the residents and those employees. Also, DPH or Department of Health, have they released any funds at all to local towns, the boards of health at all for this?
There is monies released from the DPH through the CMRPC. They said to estimate the costs that we've spent so far on it, just for public health, and to estimate what we would do through the next 2 months, what we would cost. And then they made the foolish statement of be generous. So I put in a potential of $22,000. They have $250,000 to be shared by 41 communities. So that comes out to about $6,000 per community. I can only guess that the larger communities are going to get the larger chunks. So I do not expect $22,000, but I fully expect that if it becomes implemented, the town of Southbridge will recognize some of that in the town, and I'll have to work with Ms. Harnois in finance to determine how that's got to be kept separately in case we have to return what's not used and all of that type of stuff, but we'll work that.
So that leaves the next question then, and what specifically, if you receive 6 or 5, or if you get the whole basket, what are you specifically looking at for using it? Is it directed to use it for certain things by the state or the feds?
It needs to be dedicated to public health and public health actions. So I put in for expected overtime based on this. I put in for, because it was a public health action that caused those workers to be out of work, I put in for the back pay for them. I put in for supplies if and when PPE becomes available. I put in for, I think I put in $2,000 for supplies. I also put in a note on the thing that should an EDS site become appropriate, that we will need a significantly more money, and I put an estimate of that at $21,000. So in addition to the 22, I put in a notice that we might be looking for more.
And last question, and you don't have to go into detail with this, your EDS site, your emergency dispensing site, has that been updated? Have you guys, or is it just still fluid, trying to figure out where locations may end up going throughout the town?
Unfortunately, well, our EDS site right now for this event, because separation is significant on this, we would use the drive-through EDS site, which is what we've been given the most attention to recently. The reason we would use the drive-through EDS site is because that family who lives together and are already exposed to each other is going to be in their car, and they are not going to be standing in line right behind somebody who wasn't exposed to that family. Okay. So a drive-through site for communicable disease is ideal. How good it will work if the vaccine is not oral, if it's a shot, might be a little more difficult. You know, when Bob shows up with his Doberman pincer in the back seat, I don't want my nurses reaching into a car to give a shot. But we'll deal with that as it comes up.
I'm sure it'll change here and there. But, okay, thank you very much.
Very good.
Mr. Town Manager?
Thank you, Mr. Chairman. I just want to make a couple of comments on this domestic flight issue because first I want to let everybody know that this, the decisions we made was not without a lot of thought and a lot of discussion. The domestic flight issue had us concerned because obviously I think everyone knows airline flights are being canceled all over the country because of the fear of this particular issue. There's been a lot of talk about potentially, airlines closing down, reducing flights, airports closing down because there's such huge amount of people traveling through airports, and the airplanes themselves are sort of self-contained, and you can't practice social distancing on an airplane. Myself and the public agent had just massive conversation over this, trying to figure out what was the right course of action. And we reached out to the State Department of Public Health. We actually ended up reaching out to the hospital to get some guidance on the issue because there really wasn't much guidance on this issue anywhere. The decision to made originally, and we originally, as you know, we originally talked about 14 days before we allow employees to come back. A lot of that was because these particular employees were emergency workers. They were ambulance drivers. And we wanted to make sure that when those employees came back that they didn't contaminate other employees within the EMS department. So, we were being cautious to protect, because as you know, providing ambulances to people right now is a critical service, and we were very concerned of doing anything that might harm that or to somehow put it where all of a sudden the virus spread throughout our emergency services there. So, as we learned more, as we talked to the hospital, as we got answers from the state, as we looked at, I know other counselors made comments and the fire chief made comments, we were able to change that decision and the Board of Health changed it. But I didn't want you to get the impression that this was done quickly or thoughtlessly. There was a tremendous amount of discussion and comments and reaching out to get that information. And, it's a little scary now because even now you wonder, if you make the right decision or not. But I think the Board of Health, after giving a lot of deliberation, came to the conclusion that it was important to get those employees back to work and that it was safe for them to come back. So.
Can I just respond to that real quick to the town manager, Mr. Chair? No, all I wanted was an update from, I know it was 14 days, then it was nothing, then it was 5 days, and then now I just wanted to get an update as of today, as of the meeting at 12 o'clock today. Last thing is I do know the state provided guidance for that. So thank you.
Thank you.
I have not received any guidance for that.
Councilman?
Thank you, Mr. Chair, through you. So I just want to know, I saw something come through my email with regard to the MMA having meetings on the COVID-19. And I know their first one was yesterday afternoon, late afternoon. I was not able to hop on that call because I was on another call for work. So I want to know if the town and any of the department heads are involved in those calls, because there's going to be another great source of information and guidance is through the MMA. So.
Okay. We'll make sure we follow up on those. I missed that on the invite, but I didn't see the invite to myself from the MMA. I've gotten Mass DPH, and I know town officials have gone to the Mass DPH website, but we'll keep an eye on those. And if you do have that information, Council, the minute you see something like that, if you could forward that to the incident commanders so that they can filter down in a daily brief, because there will be daily briefs that will come out to councilors and the public, but whatever that they can provide to say, hey, MMA is holding a brief on this, we'll get that information out. Okay?
Thank you.
Thank you. Mr. Town Manager?
Just to respond, and thank you, it's a very good question. Myself and the health agent were on that call. It actually started I think it was a 10 o'clock meeting, and they had technical difficulties, so the call was postponed later in the afternoon, and we did participate in that call. So yes, we're aware of those, and we're taking advantage of all of them. So we spend quite a bit of time on conference calls.
Yeah. But we'll make sure that whatever information is provided on that, we can get those information that's pertinent to this issue filtered out to everybody that's involved. Councilor Steves?
Thank you, Mr. Chairman. Andy, a quick question. Where do things stand as far as Harrington's availability of testing, and who should get it? Can you give us the public a quick summary of who should get it, under what circumstances, what the process is if they feel that they need to get tested?
Andy, I think Harrington Hospital is putting out updates as to their testing.
Yeah, to us, yeah.
And I think Andy will say the same thing. Let's hold off on that for public right now until Harrington gets their testing procedures in place. That may be sometime next week.
Okay.
So until they provide the information to the incident commanders that they can push out, again, everything's going to be coordinated, information to the public as to what Harrington's doing, what we're doing. So I know as of right now, they're just trying to get testing for their own people right now. But I know Ed Moore had communicated to us.
I've been reading
their
those,
plan.
yes.
So we'll hold off on any further communication until we have that information, adequate information as to what the hospital is going to be doing. Anything else for Andy?
I'm good, thank you.
Councilor Catrona?
Just quickly, Mr. Chairman, I want to thank you, Andy, for the time, energy that you and the rest of the department has put into this. Much appreciated.
I'm
Thank you.
telling you that the partnership with the other departments, some of my policies basically threw mud in their face, and they're still standing beside me. So the team is just amazing, and I don't deserve any separate thanks than they do because it's just been incredible.
Thank you.
Thank you.
Thank you, Andy.
Thank you.
All right, fire and police, do you want to come up together as a unified command to say, or just give us an update as to the EOC and how fire and police are at now and moving forward? And Chief Hulick, you can join them as well because you're part of the command staff as well. Thank you.
So
And
thank
I know
you.
Chief Deputy, I just want to say first off, thank you, chiefs and your deputy chiefs. We are very fortunate to have all department heads that we have in the town, all throughout the town hall, finance department, assessors, board of health, Department of Public Health. We truly are very fortunate to have all the leadership that we have. Thank you for being the leaders that you are, and the deputy chief. So I know that on behalf of myself as a resident, and hopefully as the council chair, I thank you for everything that you're doing, and I know together in a team approach that we will survive this pandemic. So I will turn that over to Chief Norman, who is the fire chief and emergency management director, and Chief Whitney. Thank you.
Thank you, members of the council, town manager. Obviously, Chief Woodson and myself are up here as representing our unified command system, which has been said several times over the last hour or so. This is a process where we open up our EOC today, that is our Emergency Operations Center. As the town manager and the chairman of the council has explained, that all information that we're going to continue to push forward will be vetted through this system. It's important that we're all on the same page from department heads, social environments in regards to restaurants and the hospital and where we're moving forward. This is going to be a tedious process for everybody involved. This is right now, the EOC is what we're going to call on a temporary or not so, it's just a scaled down version of a full EOC center. At this point, we're just going to continue to take all the information in and try to get out the information to the rest of the town and the citizens to make sure that there is no real other safety concerns, and we're going to get through this together at this point. So,
If I could quickly, thanks again for having us tonight, Mr. Chairman, Mr. Town Manager, and members of the Town Council. So as you've heard a million times, we've talked today about the unified
Chief, you
command.
might have to
About the
move
unified
that.
command. I
Thank
have a
you.
very loud voice. Usually I'm talking to this. The unified command structure at the police department is now where it's housed, partially set up and running. It's what the fire chief, our two deputies, we feel comfortable in this. This is what we're trained for. We're partially open because we don't believe that it needs to go to a full-time status yet. That could change, of course. As far as the police department, just so people know what we're doing and what's going on, it's an all hands on deck. That's it. Everybody, every single police officer that works in my department is well aware of what this means. We work with the fire department, the board of health, the town manager, the town council, town hall employees, all the councils that are stepping up and helping us out right now. This is not paid. You guys are spending hours and hours with us a day, and I appreciate that. We're all, not just us, but everybody here is highly trained, professional. I know it's unfortunate, but I look forward to working with them every single day until we can finally get through this, and we will. We have daily briefs, as the fire chief already alluded to. Internally in my department, we have briefs every single day, so the men and women that work public safety in your community, and I know the fire department also, we brief the men and women every day so they know what they're dealing with. It changes hourly. Sometimes we put out a quick update. Sometimes I have more time to gather more information, but as we receive the information, we're putting it out. And again, I can't say enough about the people in this room tonight. you know, I know it's a difficult situation, but there's absolutely no question in my mind, we've been through it before. We'll all stand together, we'll get through this, and hopefully sooner than later. So thank you for having us.
Thank you, Chief. Anything you want to add, Chief?
No, to the continued operation of the fire department, just like the police chief has mentioned, that we're ongoing. All employees are donning and doffing PPE equipment on a daily basis, and sometimes on an every call basis. There are some regulations that we're following strictly from guidance from the Mass DPH OEMS division, and obviously this really starts at the time of 911. When a citizen or someone passing through calls 911 and it is received at the town of Southbridge, the communications specialist at the police station will ask a few key pointed questions in regards to the coronavirus and its symptoms. And that information will be passed on to the EMTs and paramedics before they respond to your incident. So we've been highly trained in PPE. That is, of course, our major barrier from contracting this horrible disease. But we're all good and ready to go, and we'll handle all other calls and fires if they do happen, as we've been over the past many years.
Councilor Marquetti, you have any questions of the two chiefs? Councilor Nash?
Not at this time, thank you.
Thank you. Councilor Nash?
Thank you, Mr. Chairman. Hopefully you can hear me. I'm just going to relay that I can't hear anything from the podium, so I don't know what's been said, but at some point I'd appreciate if someone could address the impact of rules, regulations, local states of emergency on churches and gatherings related therefore. Thank you.
Thank you. Guidance on, well, I believe in the town of Southbridge, most of the churches have closed for gatherings, and no gatherings over 25, correct? Okay. We'll get further information to you as well there, Councilor, and to the public through the briefing through the town. Councilor Manna?
Thank you, Mr. Chair, through you. I just want to say thank you to the fire and the police department for all you're doing, and stay safe out there.
Thank you. Councilor Danny?
Yes, please, through you to the fire chief. Has there been any impact on District 7 activities or mutual aid activities locally?
At this time, there has not been much activity going on, although as before this all broke out a few weeks back, we thought we were going to be very active in the brush fire fighting season. We had already had a couple of activations in general alarms for Southbridge to help out other towns. Right now, this last probably week, it's been very slow. District 7, in conjunction with all the fire chiefs, we have all worked out a plan that if we were to be called, if Southbridge was to be called to Charlton per se, they were going to be going directly to the scene of the incident. There was going to be no station coverage type of scenario. So basically, if Southbridge gets called to a scene, to an incident, it's going directly to the scene. Vice versa, we're going to do the same thing here in Southbridge. We will have that outlying town or agency cover from their facility, their station, and it's all going to keep everybody safe and not cross-contaminate any departments with any of this infection.
Thank you.
Councilor Catrona?
Thank you, Mr. Chairman. Through you, I'm not sure to the police chief or the town manager, just hearing that the playgrounds are now closed, public facilities, basketball, people like to use these facilities. Is it being explained to them why? Do we have signs posted on all the playgrounds?
Well, if I could say, this started a couple days ago after the governor's order came out, and several of my police officers observed, and I won't even single out one park, 50, 60 children throughout town at the park, basketball, swing sets, baseball, like nothing was going on in the world, negative. So I spoke with the town manager, and with his permission, and thankfully for the DPW, they acted on it immediately. We decided that the only way to eliminate that problem was to take down basketball rims and swing sets. Bit of a drastic measure, but unfortunately in certain areas of the community, it's like there was just business as usual and there was no school. So we had to put an end to that. It's posted, and I'll let the town manager speak on that. I certainly don't want to speak for him. We spoke about posting it, so I believe it is now.
Well, thank you. I want to thank you both. Thank everyone for all they do.
So, just briefly, the DPW director was instructed to put up signs at all of the parks. The police chief as soon as you notified it, we notified DPW. The night, it was in late afternoon when we were notified. The DPW director immediately got the swing sets down, and the next morning they started taking down the rim. So it was a very quick period of time where we got those things down and the parks were closed.
Thank you.
Councilor Adams?
Thank you, Mr. Chair. Just anybody can answer this, that it's up here. A question was asked to me about FEMA at all. I believe we belong to Region Number 1 in the area. Has FEMA reached out in this area at all, or within the local region itself?
In what regards?
Are we considered like a hub over here within Southbridge itself, like a FEMA hub?
Oh, we are in the MEMA district. We are in District 3, which is the main office. The District 3 office is in Agawam. I have had conversation with our representative from MEMA, yes.
Okay.
And it was more of just guidance questions, and they've basically been pushing along the DPH message and any other messages that come out of the MEMA organization.
Okay. I asked the same question as I did with Mr. Pelletier. Anything from the state bringing funds down to the local police stations, fire departments, stuff like that? Anything from them at all?
As of right now, I have not heard anything. I do sit on the Central Mass Homeland Security Council. Other than the Department of Public Health issue that you asked Andy about, I have heard nothing at this point from that aspect. I don't know if Chief Woodson has heard anything from the Police Association.
If I could, through you, Mr. Chair,
Yes.
in an unofficial capacity, I will say I believe we're going to be reimbursed for many of the costs because this is quite frankly going to have catastrophic consequences financially, not only in our community, but everywhere. And to maintain public safety, at least where we are right now, we can't close for business. We can't not pay our people. So I believe, in my opinion, as I stand here today, we will be reimbursed for most, if not all, the cost.
Okay. The only thing I'd say, Mr. Chair, is I'm looking forward to if the agenda item number 11 passes tonight. Looking forward to watching your process, and I'm sure the evaluation will change day by day by day by day and your needs and wants. Thank you very much.
I do know we did receive correspondence. I don't know if any other council, if you didn't, I will forward it from Senator Fatman's office, who reached out to. If you didn't, I apologize, because I've been going through so many emails and everything. I will forward that to my fellow councilors. His office did send us an email reaching out to several officials stating that his office is there to assist us in any manner possible, and he will work with us as much as he can. So I thank the senator for that. I thought I had forwarded, but I'll double check, because I thought I got kicked back on somebody's email. So, but I will re-forward that. I apologize. So I will get that up. Yeah. Yeah. So.
Was that from today?
No, Senator Fatman was a couple days ago. So I've been outside. I just want to thank the chiefs for being here today, and for your continued leadership to the town of Southbridge, and to your men and women in your departments. We wish them safe journeys, because as has been communicated very, very many times here and throughout the nation, to distance yourself, keep yourself safe. Fire, police, our public health do not have that option of social distancing, that when they're called, they have to go no matter what the situation is, no matter what the house is, not knowing what they're going into. So stay safe, and we thank you for everything you do. Councilman?
I'm sorry, I do have one thing. Through you, Mr. Chair, to Chief Woodson. Will you be, and to the fire chief, first, Chief Woodson, will you be utilizing the auxiliary police a lot more now for anything?
No, at this time, I don't have plans on doing that. As this situation progresses, we may need more resources, but right now, the way that we have shifts staffed, certain specialty positions, detectives, school resource officers, things like that have been reassigned. We're all on 7-day work schedules now, including myself and the deputy. So we have adequate staffing as we stand. If a police officer gets sick, dispatcher gets sick, some other issue, family issues, things like that, as the situation unfolds, we may need to rely on auxiliaries. But right now, we're trying to keep them at a distance in the building so they don't become infected or have any other issues. So that could change, but as of right now, no.
Okay, thank you. And to the fire chief, I know Councilor Steves was discussing this with me the other night. CERT, will you be calling on CERT to do anything within the community to possibly help with senior, maybe grocery shopping, or anything like that, and picking up something that they might need at the store?
So particularly on the CERT question, there are 2 current active CERT members that we have in our organization. They are CERT/auxiliary firefighters. As we move through with the EOC and the possibilities of being told to stay at home, we may activate the CERT people to make deliveries like you said, but as of right now, there's really no decision made on that. I can tell you, and I'll elaborate what Chief Woodson said about the current operations. Right now, we're staffing the fire department with 5 members at all times. 2 of those members are paramedics. So each paramedic will be assigned to a particular, the 2 ambulances. So you'll have a paramedic on each of the trucks. Obviously, when there's a fire comes in, we'll have to relay on those members to move across the floor to man the fire truck. But primarily, as you know, most of you know that most of our call volume is EMS. So at this point, we're safely staffed at that level. The call department that we currently have will be used when we need them.
Okay, and just one more thing. I know the governor earlier, I think it was earlier today, or I heard on the news that they may be calling out the National Guard. Has anyone heard anything on that for the chiefs?
And if I could, through you, Mr. Chair, a lot of people seems to draw a lot of concern when the National Guard's activated. And what I will say is I've heard 2,000 troops are going to be committed to the state. In 2011, in June, when we had the tornado in this community, I was working here. National Guard was activated. It wasn't to martial law, and I hear so many things and people blogging on our social media saying that, oh, the National Guard's activated, the world's ending, and they're going to come arrest everybody. That is absolutely not the case. They're here to support us in this town. Logistically, we welcome them here. We welcomed them here in 2011, and without them, I don't know how well we would have gotten through that. So if the National Guard does appear in our community, and they may, but I think there's other communities first, larger cities that need them more than we do, but that's not necessarily to set the alarms off and everything's going to stop. That's not a bad thing if the National Guard gets activated. If we need them, they'll be here.
I totally agree with you. It's not a bad thing. I just was curious if
No,
the
Council, I'm
governor
happy you
reached
brought it
out
up.
to you.
Because I've got asked 100 times today about
Oh,
that.
okay.
I'm just happy I can say it publicly because people need to know that that could be a good thing. We're very fortunate to have the type of military that we do in this country.
I totally agree with you 100%. And I know that Shrewsbury, they're opening up a drive-through testing site. So, I mean, has Southbridge been considered
Yes.
for anything like that?
A colleague of mine is running that drive-through, and it's public safety, first responders can make an appointment. I'm being told now, so if any of the police or fire personnel have potential exposures or issues, we can make an appointment with them, and if you call one day ahead, you can probably get it set up the next day, but it has to be by appointment, and I'm discussing that with the fire chief as we speak. We're talking about that.
Okay, do you think it would benefit you to be proactive and have all
No.
your men?
No, and I'll say,
tested?
because just what I'm hearing through the DPH, don't get tested if you don't have symptoms because you're taking tests from other people that need it. People that are sick and that's displaying symptoms. That's what I've been told. So if my police officers, I would love to send them all to get tested, but it takes away from other people.
Okay. I think that's it. Thank you so much. And again, stay safe out there. Thank you for all you do.
Thank you. Councilor Adams?
Thank you, Mr. Chair. I believe to clarify with the drive-through center, I believe you have to have a doctor's note
Correct.
send you through there. So you just can't
Right.
wake up one morning and run on down there first, at 7 o'clock in the morning and get tested for it.
And again, you're correct, Councilor Adams, you need to have symptoms and have a note sending you there, which, again, if police or first responders have symptoms, we will absolutely send them with a note.
Okay, thank you. Anything further for the chiefs? Chiefs, thank you. Be safe. Thank you very much. Agenda item 11, discussion as to declaring a local state of emergency in the town of Southbridge relative to the COVID-19 state of emergency. Take any action in declaring that a local state of emergency shall be declared. I think it's evident that a state of emergency is warranted. You have the declaration in there. This declaration was taken from, again, Copeland and Page's guidance that they had sent out to us, and I drafted for the town of Southbridge. I would gladly read it, or if anybody wants, does anybody have any further discussion on declaring an emergency, or would like to make a motion to declare such local emergency? Councilor Steves, you have a
I do
question?
have a question on it. I just want to know, if we vote to do this, what exactly does this entail the town? What does it allow the town to do that it
can't
doesn't
hear you.
already do?
So, again, what it will allow the town to do, it would just, the Civil Defense Act, it invokes the Civil Defense Act. Also, the biggest caveat to this, again, is the reimbursement to the town of Southbridge, to the ability to, once any reimbursement comes, usually looks to, and given my past experience, and Karen, if she has any input, typically is when you do federal and state reimbursements, you have to really write down everything that you stated that cost you money. And then sometimes what the caveat is, well, did you declare yourself a local emergency? If not, we're going to cut out some of those funding.
Okay.
So it's really for the funding mechanism. It also allows us some flexibility under the Civil Defense Act for police officers and the such. But it's just really most towns are, town of Dudley, Oxford, Charlton, they've all declared local states of emergency. It's a recommendation that we do so. Do you have any further questions on that, Councilor Steves?
At the moment, no.
Okay. Councilor Manna?
Okay, so I'm just going to ask a question again.
Yeah.
Will this open up the line to reinforce the guidelines that the state of Oregon for no gatherings of 25 or more? I just read an email that I hadn't had a chance to with regards to someone's concern down at Renaissance with the not going by the guidelines. So would this open up the lines to reinforce the state guidelines for, look, you can't have this? I mean, if our churches can't have it, if we can't have, if our theaters can't be open, if stores are closing down, if all schools are canceled, if school activities, after-school activities are canceled because of this threat, and a lot that I just mentioned are with younger people, this is with the elderly, and this is a really great concern.
And I think given the fact that that issue has been brought to the Department of Public Health through our local Department of Public Health, whatever they can do within their power to make sure that they, if the case is that the public health says that they have to shut down, then that's up to the Board of Health. This is really a declaration to us. We're working in partnership with the Board of Health and our Director of Inspections to make sure that we follow all the guidelines that we can. I'm sure, I'm not going to speak for Andy, but I think the Board of Health and the inspection will work with the incident commanders now to make sure that whatever guidance they can to enforce and make sure that they can articulate the reason why they can close, they will do so. And again, that was brought to our attention today, so we need to work our way through that, make sure that we follow whatever guidelines through Mass Health and DPH and all that.
And I understand that, and if Mr. Pelletier is saying, is what he's saying is true with what Mass Health said, then maybe somebody should contact the governor's office or Senator Fatman's office and say, hey, look, you're telling us on on state, local television that these are the guidelines and we're enforcing them, but yet you're letting your own departments go against the guidelines. Shame on you. So maybe if we shame them and, and shame on Renaissance. Shame on Renaissance.
And all I'm going to say is I agree, I think as this event is unfolding, there's all kinds of little things that you think about or that come up that you then send back through your partners throughout the state that say, hey, this is a loophole that somebody found. You're telling this. No different than I think the elementary daycares, right? Or even schools. The governor had come down with the first edict that said no gatherings over 250 people. That was the first wave. But I'm keeping schools open. And there was a lot of pushback that said, hey, schools have 250, 500, 1,000 kids. How can you say we're not going to have gatherings of 250 when these kids are going home, going to their grandparents and all that? It changed. It said, hey, schools are closed. But you know what? daycares are going to stay open, or early elementary education, because we had that conversation with the Board of Health when we closed the schools for 2 weeks. Early elementary came down and said, well, the guideline says you can keep it open. Then there was a lot of pushback saying, hey, come on, you're saying all schools are closed, but you got a group of 50, 60, 70 kids in this, we're closing that. So I think we'll push that up the line and make sure we get some guidance of it, and it really is evolving every single day. So, but we will follow that up, and I appreciate your comment.
Thank you, Mr. Chair, and again, shame on Renaissance if they hold this. That's all.
Councilor Adams?
Thank you, Mr. Chair. Just to add or caveat of what you're talking about, by doing this, implements an emergency plan within the town itself. It provides other resources that we didn't have before. It changes almost the focus of the government in a way that would help the local community, cuts away some of the red tape. You now have a structure of command for this one instance or this one issue. So now, all of a sudden, now you're going to have one voice instead of multiple voices coming down. So it brings hopefully some calmness as well to our local community. Thank you.
Thank you. Any further discussion on this? I will gladly read the declaration if somebody wants to make a motion to vote to declare.
Motion.
So moved.
Second.
Okay. Town of Southbridge, Southbridge Town Council Emergency Declaration. Whereas the 2019 novel coronavirus COVID-19 is a highly contagious and potentially fatal respiratory disease, the prevalence of which is increasing rapidly throughout the world, inclusive of the United States and the Commonwealth of Massachusetts. And whereas on March 11, 2020, the World Health Organization designated the COVID-19 outbreak a pandemic health emergency. And whereas on March 10, 2020, the Governor of the Commonwealth of Massachusetts issued a declaration of a state of emergency to respond to COVID-19. And whereas on March 13, 2020, the President of the United States announced a national declaration of emergency. And whereas on March 15, 2020, Governor Baker announced emergency actions to respond to the evolving COVID-19 public health emergency impacting the Commonwealth, including prohibitions on public gatherings of 25 or more people, and prohibiting on-premises consumption of food or drink at bars and restaurants from March 17, 2020 until April 6, 2020, as well as suspension of elementary and secondary school education operations from March 17, 2020 until April 6, 2020. And whereas the Town Council of the Town of Southbridge and its Board of Health, in consultation with the State Department of Public Health, has determined that COVID-19 presents a major disaster which poses an immediate threat to public health. Can you, whoever's there, can you mute your phone for a minute, please? Prevents a major disaster which poses an immediate threat to public health, safety, and general welfare of people residing both within and outside of Southbridge. And whereas the Town Council of the Town of Southbridge and its Board of Health have determined that immediate public action is needed in order to prevent or minimize the spread of COVID-19 by and among the people of Southbridge, and whereas it is critical to take additional steps to prepare for, respond to, and mitigate the spread of COVID-19 to protect the health and welfare of the people of Southbridge. And whereas declaring a state of emergency will facilitate and expedite the use of resources to protect persons from the impacts of COVID-19, including but not limited to emergency expenditures pursuant to Mass General Law, Chapter 44, Section 31, and limitations on operating hours and access to public buildings. And whereas the Town Council of the Town of Southbridge recommended that a state of emergency be declared in the Town of Southbridge, now therefore we, the Town Council of the Town of Southbridge, Massachusetts, hereby declare that as of March 20th, 2020, a state of emergency exists in the Town of Southbridge. This declaration of emergency shall remain in effect until further notice is given pursuant to our judgment that the conditions leading to this declaration no longer exist, dated March 20th, 2020. Is there any discussion on this declaration? Councilor Adams.
Mr. Chair, I just want to make sure that the two that are on
Yeah,
the phone are heard.
Yeah. Councilor Marquetti, do you have any questions on this declaration?
I do. Can you hear me?
Yeah. Go ahead.
So,
Yes.
Okay, when I asked you yesterday what this meant, a local state of emergency, and you said this was for excessive spending. But I feel that any spending in this town should be in accordance with our needs and with our authorization. I'm not interested in giving anybody a blank check, so I wouldn't be in favor of a declaration beyond our state orders. I mean, if you want to have that we would accept funds from the state, that's fine, but just to hand somebody a blank check, I wouldn't be in favor of that. The governor has suspended open meeting laws, so it's easy for you to call a meeting anytime. You don't even need a quorum here. You don't even need 48 hours, really, with a state of emergency to call the meeting. So I would just ask that if you want to do this, fine, but only for accepting funds, and I still feel the town council should be voting on it.
Okay, thank you.
And that's it.
Councilor Nash, did you have anything?
Thank you, Mr. Chairman. I've educated myself with materials that have been presented and in conversation. I'm comfortable with the material and with the discussion. Thank you.
Thank you, sir. Councilor Steves.
Yeah, quick question. One of the things I was thinking about, we've seen so many issues with people being left out of their jobs, or their businesses closing or whatnot. Do you think there's any opportunity for using this? I don't know if we even have the funds to do this, but some way that might be able to help us help our own citizens financially through this issue? I don't know if we could even do that, but is there any way to do that?
I think that would be a discussion later on down the road once we have more information of where we're going on this.
Okay.
But certainly, I do know in my conversations with some local decisions that we possibly need to look at or have looked at is before this event, the tax collector's office had issued water shutoff notices pursuant on the regular collection activities, and we will not pursue those collections because people are out of work. So I think as this evolves, we'll look at it. I think this really gives us the opportunity to, if for some chance overtime goes over because of the emergency, yes, we do have the opportunity to transfer monies, but also that takes a little bit of work. And if there's potential for reimbursement, such as snow and ice, where you can deficit spend and then adjust it later on, that would be the ability of the finance department. I don't think we're giving a blank check to anyone to say you go spend whatever you want. This is for the emergency for COVID-19. Anything would be just relative to the COVID-19 response. It does not mean that any other department can go by whatever they want to do. It's only expenses relative to this emergency and the declaration of the emergency of COVID-19.
No, I understand that from the
No, I'm just for Council Marquetti as well. It's only for that.
And I was also, what I was curious is, and maybe this isn't the right time to ask this, but maybe we, as a council, we ought to consider a little bit about what we can do, if we can, to help the people that aren't actually town employees out there who are stuck at home, who have essentially lost their jobs, or maybe in limbo somewhere and have no idea what they're doing, and maybe not know how to pay rent, or have an issue with they have a business that they now don't have any business doing. So.
Well, I think
that kind of stuff. I don't know if we could do that. I don't know if we'd have the funds to do that. But I know it's
I don't think we have the funds to do that, but we do have mechanism like the Economic Development Office that can work with the state and local partners that are working through, there was just, Councilor Adams probably has more information than I do, where there was a release of some funding for small businesses and small businesses loan. So as a town, those are the type of activities that we can do. We can certainly provide through the senior center, because the senior center director is still working. If there's questions for seniors, that they can contact the senior center by phone and have conversations about what kind of ability do we still have. We do know that some of the food pantries are out there still operating, so we can assist as best partners we can. As far as money right now, that's not a discussion we can prepare to have right now. But as a town, we'll have those resources to be able to get them out and make sure that our website and everything has links to those providers.
Okay.
You all set?
For now.
All right. Council Manna?
Thank you, Mr. Chair, through you. So to Council Marquetti's point, if he heard Council Adams' talk, and by listening to the governor and everything, yes, a state of emergency does open up the avenues for the resources to come in. And we are going to get reimbursed, just like the chief of police said. The president is working together, and everyone in Washington, it's like a miracle of all miracles. They're working together to ensure that we as a nation don't fail and don't go into a deep recession or another depression. Councilor Steves, to your point, helping out people who all of a sudden are like, they have no jobs. Unemployment, they relaxed the laws on unemployment, so there's like, within a week, you'll get that. The federal income tax deadline got extended to July 15th. So if you haven't filed your taxes yet and you owe money, you're not going to get penalized. Student loans for college students, those have been suspended, the payments for 60 days, no penalties, no interest. So the national government is working with all the states and all the communities, all the governors, to ensure that, everyone doesn't get missed. And we just have to, I support this 100% because I know what it will bring us. And thank you, Councilor Adams, for pointing that out earlier, too. And that's all. Thank you.
Thank you. Councilor Adams, did you have some?
Actually, thank you, Mr. Chair. I just wanted to throw out there that I talked to Rosemary, I don't know, probably 3 or 4 days ago and asked her because the Small Business Association, or I want to, SBA, has put that information out. She, and I think the town manager put that on those applications and the requirements on the front page of the website as well. But I long extensive talk with Ms. Scrivens, and just to know that this is part of the process as well. Thank you.
Councilor Mann?
Thank you. I apologize, Mr. Chair, through you. Just one more thing. I also want to mention, too, within 2 to 3 weeks, families making under $75,000 a year will be getting a check from the government. So, and like, it depends on like where you are. If you're married, if you have children, if you're single, on the amount you'll get. But they are issuing those checks for people because they understand that people are out of work and, they do need that assistance. They got to pay their bills. They don't want to see, and this isn't like that stimulus, go out and spend your money. This is to help you live, not to go out and spend it frivolously, to help you live. So, and if needed, they said, and like they'll do a second. So the government has not forgotten us. And we as a local community government won't forget our citizens either, but we can't provide them money, like I believe what you're saying. We can't do that. At one time, we had a fuel assistance fund to fundraise to help with fuel assistance. But there's certain laws that you have to take for that, and I don't think under a state of emergency it's going to say, okay, let's just give everybody in the community money. I don't think that's the case. But we are being taken care of, and that's all.
Anything further on this declaration? Anything further?
Can I say something?
Yes.
I would just like to respond that the federal government, the national government is working on this, but Congress still votes on it. All I'm asking is that we have a right to vote on this. I mean, that's why we were elected. Thank you.
Thank you. And for the record, that was Councilor Marquetti speaking.
Yes.
Okay. Anything further on this? Roll call.
Councilor Daniel, yes. Councilor Jovan.
Yes.
Councilor Manna.
Yes.
Councilor Marquetti.
Councilor Marquetti? Councilor Marquetti? No? Okay.
Councilor
Thank you.
Nash.
Councilor Nash?
Yes.
Yeah. Thank you.
Councilor Steves.
Yes.
Councilor Adams.
Yes.
Councilor Catrona.
Yes.
Thank you. Is there anything from any council wants to add through council forum relative to COVID-19 or any other issue that needs to be brought to the town manager's attention this evening? I'm not going to go through the regular thing. Councilor Steves.
I just want to mention a couple of quick things about, for people who are looking for town services, the library has a whole bunch of services that are still available, even though the building itself is closed. So you can go to the website, you can call the library itself at 764-5426 and ask them what they have available, printing a variety of other things that if you need them, ebooks, educational materials, exhibits in museums, all that stuff. Well, the museums are probably closed, but other things like that are still available. So if you're interested and you have, now that you have some more time, you may have some time to do some reading. So that's there.
Thank you. Councilor Adams.
Just real quick, thank you, Mr. Chair. I just want to thank you for all the work you've been doing, getting this prepared. And I want to thank the town employees for having an understanding and all the hard work that they're going through right now and dealing with this and having to come to work every single day. I want to thank the school and the hospital for the constant updates. And first responders, as always, really appreciate everything you do, especially this is just another feather in your cap of a long list of things that you're required to do and deal with. And those individuals that have been unselfish in providing help and support to those that need it during this period of time. Looking forward, one other thing I had mentioned before that I thought about the town council meetings probably should be upped just to provide information to the town, but seeing that the EOC will be standing up, I believe the information flow will be much faster, better, and the word will get out there, specifically to this issue. That's all I have. Thank you.
Thank you. Anybody else? Councilor Marquetti, do you have anything else?
Yeah, I do.
Okay.
Yes, I do. Can you hear me?
Yes?
I would like to ask that the town hall be cleaned, thoroughly cleaned. Somebody needs to, especially in the council chambers, I'd like to see a thorough cleaning. I'd like somebody to, if we could hire a professional to get up there and try and find if there's any bats up in the rafters. I know I've seen a few of them come down during council meetings. I know that it's being reported that bats can carry some strains of coronavirus. So I think it's important that if there are already bat nests up there, we get them out of there and we clean up the town hall as soon as possible. I'd also like to ask that, I had a message from a veteran who said he's having problems getting his benefits. It is related to the coronavirus because Boston is shut down, so they're not allowing any checks to go out. So I would just like to make sure that the veterans agent, somebody in the town hall, tries to make sure that veterans are getting benefits that they need.
Okay.
That's all I have. Thanks.
So, all right, well, Councilor, we'll contact you to get that information so that we can follow up on that. Councilor Nash, do you have anything? Okay, seeing none. Again, to the Southbridge residents, the Southbridge town government will continue to operate. We will provide safety, security, and services to the town of Southbridge. Please understand that we are in a time of uncertainty on how do we get information, meetings to you, but town government is going on, services are being provided, and if we work together, we will all get through this, and I look forward to coming back in person at some point in the near future so that we have a council meeting. But please follow all the guidance that's been provided out in the, by the President of the United States, by the Governor of Massachusetts, by our Department of Public Health. We will get through this, and we'll be fine. And we thank you all for all your support, and we look forward to seeing you back in person soon. With that, I'll entertain a motion to adjourn.
Second.
Okay, roll call. Councilor Steves.
Yes.
Councilor Manna.
Yes.
Councilor Daniel.
Yes.
Councilor Catrona.
Yes.
Councilor Adams.
Yes.
Councilor Marquetti.
Yeah.
Councilor Nash. Okay, thank you. Meeting adjourned.